Welcome back. In this video, we'll talk about thyroidectomy. To reach the thyroid, first we must cut the skin and the subcutaneous tissues. And then we cut the platysma muscle, which is a wide horizontal sheet, and flap it. And then we separate the strap muscles, which are vertical sheets immediately behind the anterior jugular veins. The strap muscles must be separated and not dissected. But if you're going to dissect them anyway, make sure that you do so as superiorly as possible, near the skull. This is done to avoid injuring the ansa cervicularis nerve, which supplies the strap muscles as well as the omohyoid muscles. During thyroidectomy, make sure that you ligate the inferior thyroid artery near the gland, and if possible at the gland, and the superior thyroid artery as away from the gland as possible. We do this to avoid injuring the recurrent laryngeal nerve and the superior laryngeal nerve respectively. In rare cases, about 5 to 10%, another artery originating from the aortic arch or the base of the right brachiocephalic artery ascends all the way to the thyroid. This is known as the EMA artery, and it of course has to be ligated as well during thyroidectomy. Talking about venous drainage, the superior and middle thyroid veins drain directly into the external jugular veins, and the inferior thyroid vein drains into the brachiocephalic trunk. The inferior thyroid artery supplies both the superior and inferior parathyroid glands, and this is very important to know, especially for exams. And the venous drainage of the parathyroid glands is so variable that it's not worth memorizing. It is very unlikely that you'll be asked about the venous drainage of the parathyroid glands. And here's a small quiz. Which of the following is supplied by the internal carotid artery? This is actually very tricky, especially for exams. The internal carotid artery does not supply anything in the neck at all. It supplies only the skull organs, starting with the ophthalmic artery, as soon as it enters the skull. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helped.